Come on, man. I should have looked where I was pressing.
What up, everybody?
And last week, I definitely forgot the sponsors. We got into some good conversation early and often, though. Kind of got away from it, so probably should do it right now before moving forward and get that captured.
I think we know by now, Jazz Cabbage Cafe is sponsored by Stone Depot, Redemption Cannabis, Real Leaf Solutions, the Detroit Nutrient Company, GrowGreenMI.com, Custom 420 promos with their amazing CultureClothing.club, and Meds Cafe.
What up, Adam?
Hey, now.
You look more lively today than last time I saw you, sir. Good. I'm glad to see it.
I was rushing in from an outdoor adventure, so happy I was able to make it in time for the beginning. You're muted, Jamie.
That was good for you.
Great way to start the show.
I know you got some rest last night because I witnessed it.
Yeah.
Did Adam fall asleep on Medical Mondays again?
I did fall asleep.
That's how exciting it was. I don't know
Yeah.
how many meds he was on. One of the combination thereof.
It's a combination of a few things, actually, but my days are long, you know.
I understand that.
But yes,
Well-
I did fall asleep last night, and I think my wife actually came in and woke me up.
You could hear her saying, "Adam, are you okay?" Adam,
Yeah.
Adam. So when he moved, everybody's like, "All right, good."
That's Jamie Lowell cracking on Adam, Brooke, Mr. Hash Bash. We're here with Anton Harb and myself, Rick Thompson. Welcome to
Yep.
Jazz Cabbage.
What's up, everybody?
Just recounting facts.
For those people who don't have the privilege of audio because they're listening to us on a podcast service like, Audible or Spreaker, all the others we do.
Wherever
What's
all
new? Lots
the
new, right?
platforms are.
There's so much new stuff. We have a lot of cannabis regulatory agency things to talk about today.
Harm
There's-
reduction. Pamela
harm
is going to
reduction
join us.
coming up
Looking
too.
forward to that. But
Hopefully.
definitely, we got a lot of news. We have what appear to be inappropriate donations being made from MCMA participants to decision makers. There's sales have dipped. I know Rick's got some stuff to talk about that. A few things going on as far as that goes. So, in fact, what was it? Was it January sales?
January sales. But by the way, happy Valentine's Day, everyone. It's
Sure
February
enough.
14th.
Sure enough. Yeah.
So,
But wouldn't January sales be expected to dip?
typically, we've been going up, although January is a little bit different than December. I think year to date, year over year, what we're looking at here. So cannabis sales softened about 6.5% in January compared to December. They did increase about 36% from a year ago. It's up to 207.3 million per month, but it is a little bit down versus December. If I take a look at the previous Decembers, January. Yeah, January in 2021 to 2022 fell, and so did the December to January from 20 to 21 increased. But
Well,
again, back then it was such a new market, it was almost impossible to have a downtime
right.
because everything was just on that up slope, and no matter what happened, it was just going to continue to increase.
Yeah, and the COVID and the essential service and all that stuff. Yeah.
It really doesn't matter what the number is; they still can't get it right.
Well, here's one thing I'll say, and this is what I wanted to mention. Today. When we talk about January sales, down a little bit from December, there are 5 markets in the United States of America that actually lost market share, lost percentage in the year of 2022. We're talking about all the mature markets: Nevada, Oregon, Washington, California, Colorado, all of those that are considered to be a little bit more mature than ours. And some of those are only 1 year more mature than ours. Maine surged because, again, Maine's still on that impossible to break uphill stroke. And we are approaching, from new market to mature market type status where we're going to plateau. But when we look at the example being set by these other states, we're really seeing what could be coming up at the end of 2023 or in 2024, even 2025. We take a look at the national trend in these markets that are 2 to 3 years older than ours. We can see that their peak and valley is sort of started to decline. I would suggest to you, and I'm sure Adam will agree, that doesn't necessarily mean that fewer people are smoking cannabis. It means fewer people are using the regulated market as their source of cannabis.
Right.
And of course, the unregulated market, those of us who use sources that are not legally licensed in a state, that's actually the entire pool of new recruits for the regulated market, because we already have budgeted money and we make regular purchases and we have a lifestyle to continue to pursue. So I'm going to try and share my screen here. We tried this earlier today. It worked out just fine. That's Michigan cannabis sales. So take a look at this. This is adult use and medical sales. Now, this is only through the third quarter of 2022, but you can see Washington down 13%, Nevada down almost 16%, Oregon 17% down, Colorado down 21%. Now, our medical sales have continued to plummet, but our adult use is continuing to rise. You'll see that we're on the top of this chart through 3 quarters of 2022, and that's at a 26.8% growth. So beating even Massachusetts and Arizona, which are strong markets as well. So you're looking at a lot of states where there's systemic failures. Colorado's total sales, take a look at this, from 2191 in 2020 to 2228 in 2021. That's a really small increase. That's barely an increase at all. If we take a look at just adult use sales too, by the way, this is the new Cannabis Ventures or Cannabis Business Times website, so let's give proper credit where it belongs. Adult use cannabis sales only. You can see that Maine is really out there with 110% because they are on that never-ending increase cycle right now. But we're the second in the nation as adult use cannabis sales growth with 55.8, Arizona at 55.3. Illinois' adult use market is more recently online than ours with a smaller growth, and so is Massachusetts. Massachusetts is experiencing right now a crippling price drop, similar to what we've had here in Michigan. But take a look at Colorado, adult use only. Adult use only in Colorado. Rec sales in Colorado down 16%. And in Oregon, down 15%. And in California, down 7.5%. So when we start talking about down 6.5% here in Michigan, it's not great. But compared to what we're looking at as a national example, this isn't as catastrophic as we've seen in other places. However, those people in the regulated market would do well to note, as I mentioned, those markets that are 2 to 3 years more mature than ours, when you come off that plateau, it seems like that's a pretty steep drop. If you're dropping 16% in a single year, that's a pretty precipitous fall when you're talking about the millions and billions of dollars that the cannabis industry represents in a single state. So that is what I wished to share with everyone today as far as the national cannabis sales trends go.
Right on. There's got to be that point at which the lower cost cannabis and how much you get at one time, and all that comes together to equal those sales look like. People get enough what they need for a certain period of time with less money over time as things fall and all the percentages come down.
I watched an interview with a pretty respected leader of one of the regulated market companies who said my biggest enemy is the unregulated market, not because they're trying to steal my customers or anything, but because it's a price war between us and them. And I have to bring my costs down to equate with that. And although I can understand that there's a market force that says you have to compete with, a cost conscious cannabis consumer, there's also something to be said for having better quality cannabis than anybody else. And if the regulated marketplace had cannabis that just totally blew you away, you'd be flipping your ID at the door and walking in to get it. So I disagree that the only solution to the regulated market's problems is to continue to produce boof at $40 an ounce. I don't think that's the solution. What's that, Adam?
I think it's all about quality, and that's what's going to make up the difference. I mean, there's more users than ever, and there's probably more home growers than ever.
It started making the difference in other states with coming out of the saturation issues and
and the farther we get away from reefer madness and illegality, the more people are willing to break the law and grow cannabis in their house. They don't care what the law is. They don't care that you're limited to 12 plants, because they know that if they get caught, it's no big deal. Nobody cares anymore.
That was the point, kind of. It's not worth really investigating those things.
Right. And the quality, trust me, guys with high quality weed are still getting top dollar for it. I saw it the other day. I saw $200-300 an ounce weed that was top shelf that I would have gladly paid that kind of money for if I was in the market.
Well, I mean, it may not be a Jazz Cabbage record, but in the first 10 minutes, I probably bored everybody that's been watching this program with my national cannabis sales thing. So hopefully this is a better conversation to bring people back into the fold here.
Fortunately, Pam Lynch has joined us in the meantime. So we don't have to be stuck.
You didn't bore me. I was like, I was listening to you talk, Rick, and I was like, man, why do I ever miss this show, man? I love this show. I got to remember to tune in every week. So no, it was really interesting. So thank you for the information you shared with all of us.
You're welcome. And that information about cannabis sales in January just out today. So that's hot off the presses. You haven't even seen that in print media, I don't think yet, unless it's the national one. New Cannabis Ventures seems to be Johnny on the spot with their analysis of state sales numbers even before state people know that the numbers have been published. So
they don't by any chance print the list of fines, do they?
List of what?
Fines.
Yes, of course. Every month. Who got fined? Who got dinged?
New Cannabis Ventures does.
I'm sorry.
New Cannabis Ventures does.
Oh no, I'm sorry.
No, CRA does.
Yeah, no, I know the CRA does. I'd like
the New Cannabis Ventures reports on the extraordinary measures taken in different states when somebody really screws up and has a big fine or suspension of license. They usually cover that, but on a monthly basis to talk about people who got dinged for an annual financial statement, that's not really. Although, I mean, we did see a huge, gigantic problem with one of these cannabis processors in Vassar, Michigan.
I was going to say Saginaw area, but that's the area. Yeah.
Yeah.
Yep. And Vassar, who had barrels of stuff, a whole big green thing, a trailer out back with 10 jars of unlabeled distillate, one of which had a New York sticker on it. So,
I just find at the same time, I find the list kind of petty because someone made a clerical error or didn't file on time. They get this outrageous $10,000 fine, and some of it makes sense, some of it doesn't to me. I mean,
that's a max fine, and they were doing stuff like making it 7,000 or 8,000 depending on the circumstances, and it was being listed and stuff. And now everything is kind of like the max. They're trying to actually raise revenue.
I have seen fines in the $2,000 range previously, but now it seems as if they're not executing any discretion. They're just going for the max every single time they get somebody for a particular violation. Perhaps that seems less discriminatory or less discretionary, but I don't think it's any less justice.
It's It's kind
Kind
of
of obnoxious.
More to come too. Lots more enforcement out there, I'm sure, about just things we haven't even heard about yet.
Right.
And each time we hear about something, you kind of just shake your
Well-
head. I mean, barrels of distillate laying around. Come on.
you know,
And the other
the
thing is, why did
Yeah.
it take so long to discover something like that? Clearly, that's a group of people that have a pattern of behavior. But I mean, again, you're limited in the number of enforcement agents that you have. There are
Well-
hundreds of licensees.
But you're not. But Rick, you're not limited, because when they see the income that this generates, they're going to then hire more, and they're going to bring in more fines, and then they're going to hire more investigators. I mean, that's how law enforcement works. And
the DEA just recently said they consider some of the synthetic THC versions you can make from, you know, hemp derived CBD, which
right.
is not on the controlled substance list, but they consider it, those substances, when they're made, to be
Well,
Schedule 1 controlled substances.
let,
These are
let,
synthetic, yeah. That's what they're saying. I
And-
read that yesterday.
they're not
Well,
necessarily wrong by definition, but let's get
Well,
that.
except for that assumes that if the stuff gets hot at any point and then comes back down, that it disqualified itself during that process. I mean, that's kind of an assumption. I don't know if that's actually some legal description someplace.
I was reading it's something to do with the chemistry. I think they call it the acetate process, that when they're taking the Delta 8 and they're using whatever chemical process that they do to either make the Delta 9 or Delta 8 through the hemp, that the chemical process that they use to derive that cannabinoid is considered synthetic. And that is the reason that they're considering it Schedule 1 and not coming from hemp, because they're changing the chemistry using a synthetic process instead of just pulling it right. It's not naturally occurring within the hemp at its base form. That's kind of what I
Right,
read.
but that's a selective interpretation, which pushes
But-
it back into their court of control, and it being still illegal and necessary, stupidly, to be on the list and all that kind of stuff.
Unfortunately, we need this to get into court. And right now, all we have is the DEA running their mouth. So somebody's got to get busted for this, and then they got to challenge it. And they got to get the court to either agree to what the DEA is saying or not. And, you know, it makes sense that if cannabinoids are legal, then cannabinoids are legal. I can't see a court saying some are legal and some are not.
Well, we've had that decision here in Michigan, though. I mean, there's been judges at different levels that have said the process of creating concentrates creates a synthetic cannabis. We're really talking about a change in state. When you go from a botanical cannabis plant and then you produce, let's call it a shatter or a batter or any of those things, it's a completely different compound at that point. It no longer resembles anything like the original state that it came from. So to an untrained eye or to a person who's not familiar with the plant, that can look like, synthetic wizardry. And it can lead them to believe that this is one of those substances that would not be protected under the cannabis laws. We had to get a court decision that clarified that any compound or derivative thereof, no matter what it looks like, earwax, diamonds and sauce, something you've scraped up off the floor, it doesn't matter. If it's got a botanical origin, then it's cannabis, regardless of what we've done to it.
And in the case of the enforcement stuff through the FOIA and the email exchanges, you can tell that the people in the lab are saying that we can tell that these concentrates were derived from the biological plant, and they weren't just created.
There are additional chemicals that are present when it's biologically derived as opposed to synthetically created. So
if somebody put all those components together synthetically, it would be a very difficult, expensive task, and ultimately not worth.
that would be the point too. I mean, you really want to imitate real cannabis products so badly that you would add all these additional things in there. It wouldn't make sense.
Well, it's unfortunate, but society did that already.
We're talking about the people who now run Viridis as the ones who were going along with that scheme at the Michigan State Police Forensic Labs.
But society has already done that with things like K2 and Spice, where they referred to it as synthetic marijuana, and it was nothing of the sort. It didn't resemble it in any way, shape, or form chemically. And because you smoked it or something, it was given a bad name, or tried to be given a bad name of marijuana. But I don't see that happening with cannabinoids. And they're cannabinoids. Why?
Anything new you don't know everything about, but if we kind of go along the same general line of the nature of these things,
yeah, I mean,
likely don't have much to worry about, and some of those things have been floating around for a while without negative response at large. So it's not conclusive,
but I was suggested THCM or O or some crazy shit by Sam the Skunk Man in Amsterdam. And he's like, the only way I'll let you try it is if you come to my house, because you're going to end up spending the afternoon on my couch.
THCO, yeah.
It's like 30 times stronger than anything you've ever tried before in your life.
I have some packets with it upstairs as drinking packets. It make you look a little tired or something, but it's not like it's, I mean, I didn't really find it to be a big deal.
I'm sure, it's the way you consume it, I think, has more of an effect. I'm sure Adam's experience was more direct.
And they had like HHC. There's other shit in there. All the stuff that they're probably talking about right now that they are viewing as a some type of way to get around, the laws and stuff. But naturally occurring THC from hemp is not a controlled substance.
420.
It's 420. So Pam Lynch, Harm Reduction Michigan, joining us again last year. Really good show. Enjoyed that conversation. Not necessarily all the stuff that's going on, but a lot of the work that's being done and lives being saved and attention being made to these, situations that are resulting in a lot of issues for people and a lot of communities and that type of stuff. Really appreciate the work that you're doing, and just wanted to kind of address that, kind of get an update on what's happening. And I know that you've recently, been distributing the Narcan boxes again, because some of those have gone to Meds Cafe and some other good stuff. So what's been happening? I'm sorry, you're muted.
Thank you. Sorry, I've got a Boxer Lab mix who's a very beloved soul around our home here, and he was diagnosed with lymphoma in September. And so if you see me jumping up, it's to let him in and out. So that's what's going on. But we're grateful for Concentrate because it's been helping him substantially, and I think he was originally given 2 months or something like that, and it's been about 8. So we're just eternally grateful for all of the benefits in so many ways. But Harm Reduction Michigan is grateful for the partnership that we've had with Botanical Company and Meds Cafe in particular. Botanical Company in Kalkaska, outside of their Kalkushka Lounge, was one of the original sites of our repurposed newspaper boxes. So let me start kind of at the beginning about this program is, vending machines have been doing harm reduction supplies and programming in other countries for a long time. And in this country, there have been some naloxone or Narcan. Narcan is the nasal version of naloxone, and Narcan's actually a brand name. So since we prefer to just stick with the name of the medication, I'll just stick with naloxone. But in these boxes and in the vending machines in the US, you're only going to find nasal formulations of this medication because it's way too controversial for any syringes to be put in those vending boxes, right? But so the vending boxes in the United States really started in sheriff's departments. I think it was LA County who had the first vending machine in their county sheriff's department, because we know that people who, after a period of abstinence, whether that's a 2-day detox, in a detox facility for a weekend, whether that's a lockup over the weekend in a county jail, or whether that's a prison stint, or whether that's a 30-day residential program, in any of those situations, because a person's tolerance for opiates comes way down in even a short period of time, if that person is then released again from detox treatment, prison or jail, and hits the street, and of course their brain is going to be craving opioids like crazy, so chances are they're going to run for the first opioid they can find in many cases, and then they're, because their tolerance is so low at that point, they're overdosing and dying, right? And so even though we work with people on trying to do, test shots and trying to be aware of the amount of fentanyl that's in the street drugs now, and to, try to be careful, try to test people's drugs for fentanyl before they ingest them, and all these kinds of helpful tips, invariably, if a person's brain is really craving opioids, they're going to run for the first opioid they can find when they get released, right? And so all too often people are dying in that situation. So people's chances of dying are about 25% higher in the first 2 weeks after prison or jail or a residential program or a detox like that. And so because law enforcement became aware of how many people were being released from prison or county jails and were hitting the streets and copping and then dying because their tolerance was so low, they wanted to make naloxone available to people releasing from county jail systems and prisons as well. So LA County was the first place to do that in the US. And then I think Las Vegas was not far behind them. And then, some of the people we worked with on the program we talked about last time we were here at Wayne State, they got a grant from the state of Michigan to buy a bunch of repurposed vending machines and place them in county sheriff's departments around the state of Michigan. And because we had been doing a lot of work with Wayne State, we also got one of those vending machines and placed it in front of our office in Baldwin. And it's been very helpful and made naloxone available in that community in a way that it was not previously available. And something that's really cool is, and a lot of people I think don't realize, is naloxone can actually be pretty expensive for independent pharmacists to stock. So even though places like CVS and Rite Aid and Meijer, they swing deals and get pretty good prices, but your little independent pharmacy guy who's in many small towns in rural Michigan, they can't necessarily afford to stock naloxone. And so what we found was, especially in our Baldwin location, the local pharmacist couldn't afford to stock it. And it wasn't that often that people would come in looking for it, right? And now, oftentimes in Michigan, doctors who've gotten hip to how effective that medication is and how it can save people from an opiate overdose, if I end up in a situation where I've got stage 4 cancer, my doctor is probably going to prescribe naloxone to me, so that with my pain medication, I'm also being given the antidote for overdose. And so we've had a lot of people that go to the pharmacy to get their prescription for naloxone filled because they've had a cancer diagnosis or something, and then small independent pharmacists don't necessarily stock this stuff. So the pharmacist in Baldwin, for example, let us know that when someone like that came in, he just sent them down to our vending machine to get the naloxone because it was free and it's available 24/7, 365. And so that's a big difference between having a box inside a county jail facility and having a box on the street in front of our offices, or in front of Meds Cafe, or in front of the Kalkushka Lounge, because unfortunately there's still so much stigma around opioid dependency and opioid use in our country and our state in particular, that a lot of people don't want to be known to even need naloxone, right? And so they would rather go at a time where nobody's watching them, and maybe get, a few kits out of the box so that they have them at home. I like to tell people, you want to think about it like a fire extinguisher. Hopefully you never have to use it. But believe me, if you're ever in a situation where you might need it, you're going to be really happy that you have it. And so we really want to encourage people to go ahead and get some naloxone and have it in their homes. And just, it's like part of a first aid kit. It is not intoxicating. it has zero purpose except for to block the receptors in a person's brain. I recently did a training in Central Lake, the Torch Lake Dispensary. The woman that owns that, she also put a naloxone dispensing newspaper box of ours in front of her dispensary there in Central Lake. And, I did a training for the school personnel there recently, and one of the teachers, I started to pass out some expired Narcan kits that the teachers could practice with. And I set a couple down on this table. On this table. And this one teacher starts to go, "Oh, wow, I better be careful." And so I looked at him and I said, that's one of the misconceptions, is this medication has no intoxicating effects whatsoever. There's no getting high on naloxone. If anything, people don't like it because if they are on opiates, it makes them drug sick immediately because it blocks the receptors in your brain. And so, there are a lot of misconceptions like that out there about Narcan. And I had to explain to them, hey, if people were getting high off this medication, I'm pretty sure the sheriff's departments wouldn't have a vending machine with it in their lobby, right? And so it's not every county sheriff in the state of Michigan that has those, but a lot of them have them. Like they have them, for example, in Jackson County now. So when you're coming out of the prison, if you want to make sure your person is protected and your family has naloxone in your home, you can get it there at the Jackson County Sheriff. Monroe, which has historically been pretty conservative in terms of drug user health and things like that. Wexford County, Manistee County. So a lot of the counties have placed these vending machines in the sheriff's department. And one of our colleagues, Jamie from Wayne State, the guy who actually started implementing this, he came to visit our Cadillac clinic probably last summer. Sometime. And he and I went to the Wexford County Sheriff's Department because neither one of us had seen the box or the vending machine there yet, right? And I was really curious to see if we walked in, if people were going to try to figure out who we were and why we were there to get naloxone, and, how judged we might feel coming in, if they were keeping an eye on us. I was curious about all those things. And I was really encouraged because they weren't paying any attention to us. They couldn't have cared less that we'd come in and, gotten some naloxone out of the vending machine and taken pictures of the vending machine. And so then we were talking, to the sheriffs there and talking to their desk staff. And the part that I found interesting is that, it's right in the visitation area. So like if you've got a loved one who's locked up and, you go in there on family visitation day and you've got your kids with you, the machine is right there. So if your kids are pushing buttons, I don't know, my kids, when they were little, they liked to push buttons. They'd fight over who got to press the elevator button, right? And so there's no reason why a little kid can't press the button on those vending machines in the sheriff's departments, right? Because that's like usually one of the first questions we get in talking about our naloxone distribution boxes is, well, what if a 3-year-old takes a Narcan kit out of one of those boxes? And, the simple response to that is, well, if the 3-year-old isn't on opiates, there won't be a problem. And, most of our 3-year-olds are not on opiates, and then also mentioning to people that that same 3-year-old that could get one out of one of our repurposed newspaper boxes on the street could also get one at the sheriff's department in the family waiting area, and so it's a very safe medication. Safer than amoxicillin. It's safer than ibuprofen. So it isn't hurting anyone. And in the event that a family or a person needs it, they really want to make sure that they've got it. And, we're recommending to people that they go ahead and get it ahead of time, not to wait till you're in the situation where you need it right then. We have had some program participants of ours, one of our regular syringe access participants, needle exchange participants in Manistee was a person who comes to our office like every week and is heavily opiate dependent and has been for a long time, has a lot of medical challenges, some issues, medical problems in their spine, painful things, And they were actually going to a funeral of a friend of theirs who had died of an overdose that day. And they were all, you know, like sitting around using before they went to this funeral, and somebody went out. And they had a couple of naloxone kits, and they used the naloxone that they had on this person, but it wasn't enough because, again, there's so much fentanyl in the street drugs. So they ran down to the box that's in front of our office in Manistee, got more Narcan, and were able to come back and bring this person back. You know, when we train people, we advocate that they do contact law enforcement. You know, we have to train people. I mean, if you take a step back and you think about the position our organization is in, we have to train people publicly that they should always call 911, right? We know that that doesn't happen a lot of times because people are afraid of being charged with drug-induced homicide. Understandably, it still happens in a state like us, like Michigan. We do have a Good Samaritan bill, which is supposed to protect people who report an overdose, but we don't have a strong Good Samaritan bill. So any prosecutor worth his salt could work his way around our Good Samaritan bill. So there are still plenty of people who won't report an overdose to law enforcement. And so, but we train people to always call 911 and then, you know, start rescue breathing. So there are a few steps in this whole thing that are really important for people to realize. You know, Narcan isn't the only answer. Like Narcan doesn't do any good. Naloxone doesn't do any good if there's nobody else there.
Right.
And so unfortunately, a lot of who's dying still now is people that don't know how easy it is to access naloxone, or who are embarrassed to go get it, or who are using alone, and when they go out, there's no one to use the naloxone on them. And so then they die. And because fentanyl is pretty fast acting, they have a smaller window of opportunity to save that person. And so, you know, there's just a lot of other factors in this equation that are important to talk about.
Pam, you said something that stuck with me, and I wanted to wait until we had a moment so I could ask you about it. You mentioned that a physician, a doctor, will prescribe opiates to a person and also naloxone as well, so that they're taking both of those simultaneously. Is that correct?
Well, they're not taking the naloxone, but they want them to have the naloxone in case they were to ever need it. Because especially if it's like, you know, like somebody like my dad, you know, my dad, from my perspective, my dad had addiction. You know, his drug of choice was alcohol.
For someone who has asthma, very similar to that. It's not like a daily use type of a thing, but it is there in case of emergencies. I get the impression when you mentioned that it was a prescription for naloxone, I get the impression it was some tablet that they were taking, and I'm glad that it's not that, because I was really having a horrible vision of doctors who intentionally overprescribe opioids and then you know, make you take this other thing just to deaden you to the fact that you're being overdosed.
The roller coaster, yeah.
I know.
Yeah.
You know,
Yeah,
Rick,
well, I mean, you know, we regularly, anybody who's worked in an ER knows, can think back to patients who were given too much pain medication, right, by medical providers, you know, accidentally, and you know, and then they have to give them Narcan to bring them back, you know. And actually, one of the families we've worked with really closely here in Traverse City, the mom was a critical care nurse, and it was because of her familiarity with, you know, in her job, she regularly used Narcan to bring patients out of anesthesia, you know, after surgery. So she knew very well what this medication was. And so I was introduced, I met her and her son in the emergency department. I was a crisis responder for the Community Mental Health Authority before I came to work full time for Harm Reduction Michigan. And so I would, you know, sometimes have to respond to substance use issues that were going on in the ER. And that's how I met these people is, you know, the son had overdosed. He had actually overdosed 14 times that calendar year. And, you know, and I met them in the ER, and it's difficult, even if you're trying to get help and you're ready to get help with a chaotic substance use disorder. It's not always easy to do, right? I mean, like, you got to know where to call, and like in terms of if you want the state to pay for your treatment, you got to call one number, And then, like, I used to work for a treatment facility when I first moved back here. And well, you got to call residential, you got to call them, but then you also got to call detox. And, you know, like, they can't work together to talk to each other. You got to call both places. And then you got to call the other people who are paying for it. I mean, like, I know the system. I worked within this system. And the last time I helped somebody when I was at this community mental health authority, one of the last times I called to help somebody in that job, they worked for Meyer. They had, their drug of choice was alcohol. They'd been to treatment before, but they'd gotten back to a place with alcohol that was not doing well in his life, and he really wanted to go to residential treatment again. And so I said, okay, so Thursday, you know, you talk to your job, see if they're going to give you time off to go to treatment, and then so next Thursday when you come in, we're going to make that phone call. And so he did. It took us 6 phone calls to get treatment set up for him. And like I said, and I know, you know, I've got like the inside number to call the right people, and I know how this system works, right? And so you can just imagine, when you're a person who's not familiar with how this system works, it's not always easy to get the help that you're looking for, right? And in the meantime, we got to keep people alive. And so that's what I was trying to explain to this mother, is like, okay, so you're here in the emergency department on a Saturday night, and in northern Michigan, there are parts of Michigan, Oakland County's got a great system. If you call on at 8 p.m. on a Saturday, you're going to get assessed for treatment. If that's what you want, you're going to get assessed Saturday night. Not in northern Michigan. You got to wait 8 to 4, Monday through Friday, because, you know, that's the only time it's available to get help. Okay. So here I am Saturday night in the ER with this guy who's overdosed on his mother. And I have to explain to them that, you know, come Monday morning when this place opens up, we're going to get you on this kind of substitution therapy. Right. But in the meantime, you got to keep him alive from Saturday night till Monday morning. And so you got to have a whole bunch of Narcan, because, you know, the chances are he may overdose again between now and then. And I'm going to go back to the story of the boxes. That's actually another way that we came up. The reason that I ended up coming up with this idea of the repurposed newspaper boxes is there was a mother in Macomb County, and her son was using heroin. She had Narcan that she'd been getting from our Midland office, and she'd used it all that day. So she'd already reversed her son, right? And she was out of Narcan, and she didn't have any more. And so she's calling me. It's Wednesday night. It's 9 p.m. And I'm like trying to think of where she can go get enough Narcan, right? Because you can go to the pharmacy and buy one. And if you have insurance, you may pay a $40 copay. But one of those little nasal kits has 2 devices in it. Well, if there's a lot of fentanyl in that dope, 2 devices might not be enough. Right. So this lady may go to the pharmacy and buy one, but that might not be enough to save her son. So she's telling me on the phone that she's pretty sure her son's got more dope someplace in the house. And she's really worried because if he uses again, that he might overdose again. And then she can't reverse him because she doesn't have any more Narcan. So I was like, you know, thinking, and I was like, oh, let me get that list of vending machines from Wayne State. And I'm going to send her the list of the vending machines and see if there are any of them that are close enough to her so she can drive to one of the vending machines and get some, right? Well, there weren't any that were close enough to her. And that's when I realized that we had to come up with an alternative way to have a lot more vending machines in a lot more places throughout the state of Michigan that were a lot more affordable. The repurposed vending machines, I think when we got ours from Wayne State, it was approximately $3,000. But since then, they've basically doubled in price. And so, you know, if you're trying to put an easy access, low threshold naloxone available box on as many street corners as we can, throughout the state of Michigan, $6,000 a pop for a repurposed vending machine that requires electricity and takes up a considerable amount of real estate on the sidewalk or wherever you're going to put it, is a lot bigger of an undertaking. And then I was on Anton. I was thinking about Anton Harbin. I was actually on a community forum call. There's some community work groups that come together in these different communities. And I was on a Manistee County community forum. And there was a guy who was using repurposed newspaper boxes to make free food available to veterans. And when I heard him talking about getting repurposed or newspaper boxes from the Manistee News Advocate, and then he was taking them to the high school welding class, and the high school welding class was knocking off the change mechanism. And then he was putting free food for veterans out in these boxes. And I was like, bing, the light went on. I was like, we can do that with naloxone, and it's much cheaper and much easier. I mean, I can pick one of these repurposed newspaper boxes up myself and stick it in my trunk and drive it over to Med's Cafe in Alpena, right? Or wherever I need to drive it. Whereas when we got the repurposed vending machine, we've got to have a plug for the electricity, B, a forklift, and a big truck to move this thing in, and a couple of big guys to help move it off the truck onto the. It's just crazy, So that's when I was like, okay, we're going to start repurposing newspaper boxes and place them around Michigan communities that haven't had enough naloxone access, because I know back in the day, I don't want to go to the police station. If I need Narcan, I probably don't want to go into the police station to get it. So even though there are lots of family members that are willing to do that, and though now at this point in my life, I don't have a problem going to the police station to get some, but there was definitely, a long period of time in my life where I was, really pretty caught up, and I would not have been okay going to the police station to get Narcan, to make sure I had it, for when I might need it. And so that's the other thing, is that, we want to place these boxes in places that they're available 24/7, 365, so that people aren't worried about, having to be answering questions, going into the law enforcement places to get them. We're glad law enforcement is offering them, but we also need to make them available in places where people don't have to cross that, get over that part of the challenge in order to get some. So we're really excited because, Med's Cafe has been very gracious in receiving a couple of boxes, and we have some more boxes to place in some other locations. Same thing with Botanical Company. And, it's also very helpful because there are lots of places in the state of Michigan. I was just looking at a map of the syringe service programs that exist in the state of Michigan. And although they've grown substantially in the last number of years, there are plenty of counties that don't have any tools for people trying to keep themselves HIV negative and Hep C negative and trying to keep from dying, right? And so when you think about like all those counties that don't have those programs, they also don't have naloxone, unless you can go into a pharmacy and buy one. And again, if you're talking about street drugs, the pharmacy one kit might not be enough. That same participant in Manistee that I was talking about, who's dependent, got a pretty heavy fentanyl habit at this point. That group goes through 18 Narcan kits a week.
Ooh.
So that's the average of that group of, that social network of people who are using together. On the average, they go through 18 Narcan kits a week. Here's the thing, guys, that sounds like a lot, but in terms of a medical intervention, it's cheap. It's a really pretty cheap device, because like even if you were paying wholesale prices, $120 at a pharmacy or a not-for-profit would pay $75 to order one from the manufacturer that's got two devices in it. But still, at essentially $37 a device, that's really cheap compared to an insulin pen, really cheap compared to a pen to bring you out of a bee sting reaction, so it's actually, it may sound like a lot, but when you compare it to other medical interventions, it's actually really cheap. I mean, just yeah.
But if we don't think about the dollars about it, just think about the human cost, right? If you're talking about 18 kits per week, that's what, 9, 10 overdose experiences, maybe 7 based on how many they use each individual time. The cost on each individual person, I have to imagine that one of those OD experiences and then being, as you phrase it, brought back, that's got to have a physical cost to the human being, right?
It
Oh,
does. And you know, for the longer period of time that a person is without oxygen to their brain, you know, you go on YouTube and you can see all kinds of really sad stories of people that didn't get oxygen soon enough and are now like permanently disabled. They didn't die, but they also are living in a way that is substantially different than pre-overdose, you know, and that's maybe worst case scenario, you know, but it's been challenging. We've had a couple of things where people were angry because they look at making naloxone available as enabling, and I like to
We had
point
some
out
of that. We had a little bit of that feedback with putting the boxes at the stores. I mean, it was a minority spouting off, but
encourage
it was
people to
there.
use more.
Yeah.
what was that, Rick?
I said it just those boxes being there just encourages people to use more heroin. That's the mindset they have, right?
That's the mindset. And then also, I mean, we actually had a girl, I'm guessing it was a female by the handwriting and by, anyways, you know, those little labels that you put on a file, like if you're organizing files. So that must have been the only thing she had in her car. And she wrote on all these little labels and then stuck them on our box in Ellsworth, right? The people who own this bar in Ellsworth, they asked us for a box because they had a regular client of theirs who came in to kind of eat at the bar like every night, die of an overdose, probably was on an opioid medication of some sort. They probably didn't even know he was on an opioid medication, and, you know, died at home by himself one night. But he meant, you know, he was friends with everybody in the bar, and so the bar wanted a naloxone box in front of their bar, and so that's the box that got all these little stickers on it. And then, you know, one of the stickers was like, well, you know, you should talk to people in recovery about, you know, this is enabling. And I was like, you know, like, yo, I'm in long-term recovery. Everybody that works for Harm Reduction Michigan is in long-term recovery, or not. You know, we have some people that are, you know, probably wouldn't even classify as that, you know. So every one of us has been there. And you know, I mean, I come from an era that was, I got away from it at, you know, fentanyl was not part of my using time, you know, but you know, that's what's out there now, you know. And so people are fooling themselves if they're using any street drugs and they think they're actually using heroin. I mean, you know, last spring, the state police lab analysis lady did a great presentation at the state harm reduction conference. And that's this year again will be May 17th through 19th. So that's the state harm reduction conference, which that's the state health department. That's not Harm Reduction Michigan. Harm Reduction Michigan is our organization, but the state health department does a harm reduction conference every spring, and it will be May 17th through 19th. And it will be in Lansing, but also available online. And, you know, they invited this woman from the state police last year to talk about what they're finding in the street drugs that they confiscate. And it was literally 3% of the heroin that they confiscated had heroin in it. 3% of the samples that they confiscated statewide.
What's the source of fentanyl that's so abundant and so presumably cheap, and it's just able
really
to
it's our proximity to Mexico. You know, the cartels have figured out that it is way cheaper to manufacture and smuggle fentanyl than heroin. It's just simple mathematics. It's just a lot cheaper. And now, you know, like with the most recent opioid epidemic in this country, you know, what's crazy is all these people that, you know, think people should just stop or whatever. You know, it's a very difficult thing to stop. I mean, I've never quit smoking, but I'm told that's very, very hard. And smoking tobacco, and, you know, opiates are very, very difficult, like quitting tobacco. And so once this whole giant amount of people in this country was opiate dependent, you know, starting early 2000s, and as we were over prescribing the prescription opiates, right? And, you know, at that point, the cat's out of the bag. Like, you can't just go, you shouldn't do that. Oh, okay. That's not how it works, right? And so we've got this giant number of people who are already opiate dependent. And so now what's available out there? So they squeezed all the prescription opiates, right? And then the cartels figure out it's cheaper to import fentanyl. and to make fentanyl than to grow opium poppies and go through that whole thing. And also, it's really what it is that the cartels own the port cities. They own the ports in Mexico. So there's no stopping the precursor chemicals that are being shipped into Mexico. There's no stopping that because, it's too lucrative. So, our country has to look at why the demand.
Seems like killing off your customer base might provide an issue on some point.
Well, if you're shipping it to the United States, then you never ever see that customer base. So.
Right. Well, there's that. And then there's the money being made. And, in many, many places the cops are outgunned, along the border in Mexico, in many places, the cops are outgunned. I think it was, who's the big guy that's locked up in New York right now? And just recently they tried to arrest his son and,
Chapo.
Yeah. El Chapo's son. They tried to arrest his son recently. And the cops ended up outgunned. It's really a crazy situation. So it's, we need to figure out different ways of addressing this in this country because, number one, we've got a voracious appetite for opiates and, other things like methamphetamine. There are also cases where methamphetamine has fentanyl in it, or cocaine has fentanyl in it, and that's different in different areas of the state. One of the other really cool programs that we're participating in now.
Pam, you went on mute there.
We're working with a university that has a $60,000 drug checking machine, and so if people bring us their wrappers from the drugs that they used, or if they bring us a used cotton filter that's used in the injection process, then we can send those things in anonymously to this university and they'll test them and tell us what are in the drugs. And that's been really interesting because, again, there's no heroin in any of the opioids. It's all fentanyl. And so that's the other piece of this is that people, again, fentanyl, as people get used to using fentanyl, now their tolerance builds to require that potency, right? Because that's what happens with opioids is people build a tolerance, right? So heroin is actually not nearly as potent as something like fentanyl, oxycodone, OxyContin. Those things are more potent than heroin. They're all opioids, but heroin is potent. But when people start to get addicted to these stronger opioids, that's now what they require. So this client that I've talked about a couple times in, Manistee, but we've got them all over the place. They're addicted to fentanyl. That's what they know they're buying. That's what they want to buy. That's what their habit now requires. So that if they don't have that kind of potency, they're drug sick, right? Does that mean they deserve to die because they can't have access to naloxone in a timely way? No. So that's really what, we want to make naloxone available so that people can access it and have another chance, because when it comes down to the enabling conversation, I like to, we can have a conversation about enabling when people have a chance to learn and redo it, right? When somebody dies of an opiate overdose, there's no learning there. It's not like they go, oh, damn, I learned my lesson. I won't do that again. Nope. Too late. Right. There's no going back, so it's about people's lives being saved. Nothing can change and, or, they can't maintain their role in their family. Just because they're using opiates or opiate dependent doesn't mean that they don't have other important roles in their family and in society. And it's frustrating I feel like, I work and we work and live in a state that.
You went on mute again, Pam. Sorry.
I got to stop talking with my hands. Sorry. But, we live in a state that continues to push recovery. That's who gets all the funding. And that's, recovery is a phenomenal path for those of us who chose it. But that isn't that easy for everybody. You know, a lot of times people have got layers and layers and layers of trauma, and you know, staying alive is about the best they can do for now. And it's important for us to keep giving people that opportunity. And so, you know, we have naloxone vending boxes, these repurposed newspaper boxes, in 15 counties now. And so we're working towards more. We will soon, I hope, have one in front of Botanical Company in Lansing and another in front of Botanical Company in Tawas, and I'm hoping, and also Meds Cafe and a couple of other locations, Jackson.
Stone Depot, Jackson, yep.
Yep, Stone Depot in Jackson. And we also have them in front of different health departments. We also have them in front of different restaurants. You know, we had a woman who was in the military, and she'd seen the box outside of the Torch in Central Lake. So the dispensary that was in Central Lake, she saw that box. And when she saw that box, she was just driving down the street and she was like, I want a box. She owns a restaurant in Bel Air. And so she just sent me an email out of the blue and said, you know, I saw this box. I want one in front of my restaurant. Bel Air's had a heck of a problem with opiate overdose. There's no treatment places in Bel Air. There's nobody passing out naloxone in Bel Air. There's no, you know, community-based organizations that are distributing naloxone in Bel Air. And I'm ex-military. I have a lot of friends that were opiate dependent and some of who've died. I want a naloxone box in front of my restaurant. And so there's one in front of her restaurant. There are some in front of, there's one in front of the bar Trixie's in Hamtramck. There's one in front of a medication for opiate use disorder clinic in Westland. We have 2 boxes in Lansing in different community settings. We have 2 boxes in Flint. One in front of Serenity House and another in front of another recovery community organization. We've got another one in Port Huron in front of a recovery community organization. And I was really excited to get that one there because I was pretty sure that there was no place to get naloxone in Port Huron before those guys put that box out there. You know, so we are trying to get more boxes out to as many different communities in as many settings as possible. So that we can maybe turn around this opioid overdose epidemic in the state of Michigan. We are still going up. In 2022, we had more overdose deaths in the state of Michigan than we've ever had historically. So it's still not going in the right direction. So we have to take new approaches. And that's, you know, what we're trying to do.
Fentanyl is such a powerful drug. How small of a dose could it take for someone to trigger a potentially lethal reaction?
Very, very small, you know, but it really depends, Rick, also on a person's tolerance. You know, like that person in Manistee is using like an unbelievable amount of fentanyl in a week. That would, you know, I'd be dead, like with probably a tenth of what they use, because I'd no longer have an opiate dependency, you know.
So I can tell you this, Rick. I was prescribed fentanyl lollipops after a back surgery one time, and they were measured in micrograms. So I had 200, they were 200 micrograms, which means that when you hear this talk of a grain of fentanyl killing, being able to kill multiple people, that's much more than a microgram. It doesn't take much.
Yeah.
Right.
You know, last year when you came on, it was the prevalent issue also. I mean, not that it's shocking that just a year later it remains, but that is also the reality.
Yeah. That's like, and you know, this new drug checking program, it's pretty fascinating too, because, you know, we also distribute the little fentanyl test strips, and, you know, we've had a really hard time having funding to buy those fentanyl test strips. And at one point the county health department was supplying them, and then they decided they didn't want to supply them anymore. And so we, you know, have to like constantly be trying to raise money to buy those, to provide those also. And then, you know, I was kind of, well, you know, get like, okay, if I only have $100, do I spend it on syringes or do I spend it on fentanyl test strips? You know, I mean, a fentanyl test strip isn't going to stop somebody from using their drugs. Like they might go, okay, well, I mean, well, number one, anything you're buying on the street has fentanyl in it. Like that's no longer a question now, right? But it's been really interesting, this drug checking program, because, you know, like people look at the results of what was in their sample, and it's like, you know, quinine, some crazy stuff. So it's not just fentanyl, it's all these other things. Caffeine, some precursor chemicals, which basically means it's not properly processed fentanyl, and just a bunch of crap, and I think that when people realize that that's what they're injecting, if it was just pure fentanyl, that would be one thing, like your lollipops, Adam, that's pure fentanyl, but this is not pharmaceutical grade fentanyl.
Nope.
And it's got a bunch of other street crap in it. And, it was interesting because there's a mother here who does a lot of work in this realm. Her daughter passed probably a decade ago, and she asked me a question, which I thought was really strange. She was like, why are you checking drugs? Why are you guys doing that program? And it was a really confusing question to me, because to me, the one thing that's really frustrating to me is that people in our society, they want to associate addiction with stupidity and intellectual prowess or lack thereof. And it's my experience that people who have addiction are not lacking in intellect. And in fact, sometimes that's part of the challenge, is they have too much intellect and are bored easily. Things might have been easy for them, like in school or in business, and they think that they can think their way out of addiction. And you can't think your way out of addiction. It's got, at its roots, it's an emotional issue for most of us, right? But it's really aggravating that people want to connect, like, well, if you're going to use that, but you might die, then you must be just stupid. No, it's not about stupid. I'm dependent, but I'm not stupid. But that's why this drug checking program is really interesting too, is because when people see like what they're injecting into their veins on a daily basis, it sometimes gets people's attention and goes, wow, look at the crap that's in there, and that's really why Canada has really Canada's light years ahead of the United States in terms of their harm reduction programming. And they now are doing what they call safe supply. And so that's when people have like flunked out of methadone maintenance and flunked out of Suboxone and flunked out of residential treatment, and they've kind of tried everything else. Then what they do is they put them on a prescription for Dilaudid or a prescription for liquid morphine. And so a person can go into the clinic and get that prescription. And then, the chase is over. They don't have to, be out there chasing down opioids anymore. And
Getting
it's
desperate and whatever behavior comes along
exactly.
with that desperation.
Because like this clinic and a lot of these safe supply programs are mostly in Ontario and also in British Columbia. Those seem to be the two areas of Canada where they're most prevalent. And I was listening to this woman's fabulous presentation. She was from a clinic outside of Toronto. And she said, when we looked at most of the medical problems these people were having, it wasn't from the drug. It was from all this other crap that's in the cut that they're injecting, and that's causing harm to their veins and to their bodies. And so it actually cut their costs to their clinic by 50%, because with their safe supply program, people are no longer injecting all this crap that they shouldn't be injecting. And so it's been financially really beneficial to that clinic, because they don't have to pay for all these problems, embolisms in people's lungs and things that, have floated there because of crap that was in what they were injecting that is not meant to be injected. And so many of these challenging expensive health issues for people who are injecting got eliminated by providing them with a pure pharmaceutical grade source of the safe supply medication that they're getting at these clinics.
Wow.
So, yeah. But, that's probably light years away in this country.
What a nuanced issue this is. I mean, we talk about addiction and it seems straightforward. Talk about putting, naloxone boxes out in front of places of business. It seems so straightforward, but just jump one level past the facade. Just jump one level past what's obvious to the eye, and it becomes so much more complicated and such a larger issue. And really, there are some societal underpinnings here that are not being addressed that are really, I think, in many instances, the root cause. We have intelligent kids, but they don't have an opportunity to exercise their intelligence in our public school system, Pam. I mean, we kind of glossed over that, but that's really a big part of it. Addiction, as far as becoming an addictive personality, I think those traits and those habits begin young. We're not doing a very good job for our children and for our grandchildren.
I agree completely. Yeah, you hit the nail on the head too with the public school system. Yes, that's my 17-year-old is like, and I have to go to school because, and I'm like, you don't have that much longer. Just get through it. I see your point.
And the system definitely does not reward people who think independently and choose not to achieve a GED or a high school diploma. For many positions, including a lot of trade positions, a GED is required. And that means for a lot of people who are smart but just couldn't get into school, to have to go back and start that all over again, that can be very daunting. And some people can just not do it. And those decisions made at a young age oftentimes have repercussions that last long into adulthood.
Absolutely. Agree wholeheartedly.
Yeah. And that kind of frustration with your life can lead to drug use or opioid abuse and some of the things we're talking about. So.
Mm-hmm. But I just, it's been interesting because some other states have wanted to learn about the newspaper box program and how easy it is to replicate. We've had California, Louisiana, West Virginia, Tennessee, Georgia, a lot of different states asking, Wisconsin also about, some basic information on the program so they could replicate it in their states. And one of the core components I feel like that has given us a lot of help in Michigan is because of what Michigan did with the marijuana industry, and some of the foundation that's paid for us to buy most of the boxes that we've paid for, that we've, because we have a guy who fixes them up for us, and but they still cost us a little bit of money, and so this foundation gave us the funding to buy these boxes, and they're in New York. And, New York's behind in terms of legalization and people accessing marijuana. They don't have the time into it that Michigan does, and so, but the marijuana industry has been a very helpful piece of this because a lot of people in the marijuana industry understand the importance of this issue and the importance of the availability of naloxone. And I've met a lot of people who have used marijuana to get away from opiates, in fact, and other hard drugs. And like we talked about on last year's program. And so it's been phenomenal to have partners in that industry so willing and helpful to receive a box.
A lot of times people, they bristle when you mention cannabis and other drugs, harder drugs, heroin, fentanyl, even opioid dependence in the same sentence. But the reality is, even though those are two different compounds, look at the human factor. People that use cannabis often sometimes use other things as well, including prescription opioids. People that are addicted to some substances oftentimes are cannabis users too. When we start looking at the humans involved, it's easy to see why there'd be a connection between the two, and why the people that use cannabis but don't necessarily use opioids would still have a favorable place in their heart for those people struggling with addiction.
Yeah, well said. Thank you.
Last year we asked if you had come across what is reported often, but I don't think actually seen was fentanyl mixed with cannabis. As in the last year, has that shown up anywhere? Okay.
Still have not. As far as I know, that is still an urban myth.
And I would point out that's because fentanyl isn't used that way.
Right. I mean,
that's what proves the urban myth, is that you wouldn't use fentanyl that way.
Right.
And to be totally honest with you, I mean, some of us did live through the 80s. If you were to sprinkle fentanyl on your joint, you'd die. Because just the amount that you think an individual would add.
I think it has a different it ignites at a different temperature too.
Correct.
So.
But
Oh,
people, what
sorry.
I'm saying is, people are thinking about someone sprinkling it on to weed, and
Yes.
Yeah, they're not sprinkling like
right.
we've all known people that sprinkle cocaine and that
You wouldn't do
cocaine.
that.
You would not do that. No, you wouldn't
it-
do that
That would kill you alone.
unless you already had a huge fentanyl habit, and like I say, the people who have fentanyl habits, they're seeking fentanyl because that's what's required for them to get their sick off, because their tolerance has adjusted to it.
Take it straight. Tried the true method. Get fentanyl on board as quick as possible. Welcome to the show, Trish.
So thank you for having me again, guys.
Always a great education, and it's wonderful conversation too, Pam. You're welcome to stay for the rest of the show if you'd like. That'd be great.
Yeah, I'll probably just stay. I like hanging out here.
I've been watching Pam, actually. I love everything that you're talking about. I think it's amazing what you're doing. I'm a native of Flint, Michigan, and
Hi, Patricia.
there's a lot of that is it's a big issue out here. And I agree, like you were talking about the part where the overprescribed opiates, and that's a huge problem for my generation, because after they like a lot of the younger people that were get off their parents' insurance after everything was said and done, went in a different direction, find what they could do that was cheaper. Their insurance wouldn't cover it after they did that underneath their parents here, like for 10, 11, 12 years, until they became addicted, and there was never a program. And
Right.
it happened to a lot of people I know. So
Yep.
I love what you're doing. I think that's really cool.
Thank you.
Mm-hmm.
Pam, if people out there that have retail locations or have any kind of a business would like to talk to you about having one of these boxes put in front of their facility, how could they reach out to you and make that connection?
They can reach out to us. We have kind of a crappy website still, but we have a Facebook page that if you just look for Harm Reduction Michigan on Facebook, you can connect to us there. And then I'm going to I don't know if I can type something in the chat box. Is there a way for me to do that?
If you
I can
put something in there, I believe muted Jamie will be able to enter it into a scrolling bar at the bottom.
Okay, I'm going to have Jamie put a phone number in there, and anybody can text me or call me. Texting is probably better, because then if I'm in the middle of something, I still have a record and a reminder. But to get a box, any place that you want a box, and we supply the naloxone, and then we'll talk about how we get it restocked. But we can continue to supply the naloxone to restock it. And it's just interesting, because in some places where they're, I think honestly, Jamie, at Meds Cafe in Alpena, in the first week, all 48 of those doses were gone. So that just tells you, and no, not, if there weren't 48 overdoses that happened, but people need and want that medication so that they can be safe when the time arises, and so we're happy to restock it, and that kind of thing. But I'll give you the number, Jamie, and then just post it, and anyone can call us or text us, and we'll make sure you get a box. And we've got a lot available now, so we would be really happy to get more out there.
Is there a particular area of the state that you feel is underrepresented as far as naloxone availability? I know that there are cannabis enterprises all across the state. So if there was an area that you'd really like to focus on getting more boxes out there, where would it be?
Geez, well, we have a couple of boxes in Lansing, but we don't really have any in East Lansing. And we also would like to see some boxes in Southwest Michigan. So I think it's Cass County.
Buchanan, kind of things like that?
Yeah, yep. And, down whatever's across the border from Elkhart, Indiana, in southwestern corner of Michigan is, in a bad way. Also, the Saginaw Bay City, Midland, that tri-county area, Owasso between Flint and Saginaw, has been, a lot of not any naloxone availability for the most part. So there's some ideas.
I'm sure we have people listening in those particular areas. We'll see if we can't reach out more specifically to people.
Pam, is the number that I have for you?
Yep.
Do you want to use? Okay, I'll put that in.
Yep. Just put that in. And like I said, anybody can call or text. And then the other thing is if people find themselves in a situation where they want to know where their closest Narcan box is now because they need Narcan, or they want to go get some Narcan, all they have to do is text that number and put Narcan in a question mark, and we'll text you back information on the closest box to you. We're working.
Go ahead, Pam, please.
We're working on Pontiac. Pontiac is a place where I think we now have 2 places that are going to accept boxes. In some communities, people feel like they have to work through the powers that be to put a box on the sidewalk. I think in some communities that are more conservative, apparently city officials have made it a problem to put the box on city sidewalks. And so, but it doesn't have to be in front of your business. You know, sometimes people might rather it be behind your business. They don't really want people knowing their business. You know, so like we have a box in front of our office in Manistee, and then there's a tattoo studio downtown on like the main drag in Manistee, and they wanted a box in front of their tattoo studio. And so we put one out there, but it's like right in the middle of downtown sidewalk. And we noticed that, you know, the number of kits being taken out of the office box was like way faster than the number of kits that were being taken out of the downtown box. And I think it was just that people didn't want people to see them
exposure.
Yeah. And so, you know, sometimes behind your building might be a better place, you know, and like I said, people can, you know, we keep a running log of where they're all located, so that if anybody ever needs to know where there is one, all they got to do is text that number and with the word naloxone or Narcan and a question mark, and we'll tell them where the closest is.
I'm going to read that phone number so those people who don't have the advantage of video can actually get it. It's Pam Lynch, LYNCH, Harm Reduction MI, 231-493-5124. Just to repeat, Pam Lynch with Harm Reduction MI at 231-493-5124.
Thank you, Rick.
Yep.
Thanks very much, you guys.
Yeah, no, I hope that we're able to help you place a lot more boxes in places where they're going to do good. It's disturbing that there are still decent sized cities in the state that don't have access to this life-saving opportunity.
Yeah, thank you. Thanks very much.
Oh, wow. That was a very interesting conversation, Pam. I appreciate it. And, you know, every time you come on, I learn more.
Always enjoy my conversations here as well. So I feel like a sponge. I learn a lot when I come on here also. So
we're going to, so Pam, you're familiar with, I know you generally are with the story of the big money interests trying to position themselves and, you know, take advantage of their resources and their influences and, you know, put themselves in a better position type thing. And some of these attempts, as the influence goes, was, you know, suspected by many of us that there was a little bit more to it. And some things are starting to unfold and some investigations are revealing their findings, and we're seeing donations suspiciously put into connected accounts with some of these decision makers, the Speaker of the House and other people head of committees and that type of stuff. Anyway, Trish had a good conversation on Medical Mondays about it last night. I thought we could get into a little bit of that also here.
I'd be very interested. Yeah.
Yeah. She does a lot of research at large also on this stuff. And
I just, you know, it's pretty surprising. I mean, everybody knows the situation with, well, not everybody knows, but if you don't know, Jason Wentworth, who is the chair of the House?
He was the Speaker of the House.
Speaker of the House, yeah. He created some nonprofit organizations so that way he could have special interests basically donate to his nonprofit organization to influence him in legislation, basically. And that's already been well known for a while. But I think the creepiest thing about this is the fact that these legislators so easily were able in their minds to dismiss sick people and healers, obviously they think the caregiver program is a joke, or else they would not do what they did. So that's just kind of the things that we have to start watching out for at this point. And I guess at this point, just really, really important to really get to know your legislators in one way or another and see who will work with you. But I don't know.
Well, this is all part of a much larger issue that's being unraveled by agents like the Detroit Free Press, the Detroit News, MLive, as well as the Attorney General's office, where it looks like a former Speaker of the House, Rick Johnson, current Speaker Wentworth, former Speaker of the House, Lee Chatfield, had these what they call social justice, social consciousness, social equity funds. That don't have to reveal who their donors are. They may reveal a donation amount, but they don't have to say who gave it to them. And some of these donations are $96,000, $50,000. I'm not exactly sure how the news or the Free Press discovered that the Michigan Cannabis Manufacturers Association had made a donation of $50,000 to this particular fund. It certainly came at a time that there was pending legislation in front of the House of Representatives, anti-caregiver and patient legislation, and that was a donation by an anti-caregiver and patients organization.
Legal, I guess. So the assessment goes, but obviously ethically very questionable, and that's being looked at, I think, by a committee.
Is anybody surprised by this?
No.
Well, we all assumed at the time there was something going on. That the Meekoff scenario when he left and had the front load of cash into one of his accounts, started letting us know there was some.
When something doesn't make sense, follow the money.
Mm-hmm.
Yeah, these funds are purposefully designed to not allow you to follow the money. So,
I pinned Jason Wentworth a long time ago. It's just, if you look at the people who donated to his campaign is telling, I don't know. It's pretty interesting. This was the one that surprises me the most. And this is the reason why I kind of felt like he had something to do with, making the decision on where that legislation was going to go for, the Anti-Caregiver Act. There is the founders of Meridian Healthcare, which would be Michael Cotton, Matthew Cotton, and I don't know what the other guy's name is, but father and two sons. The father backed out of the company, and the sons took it over for a while, and then the dad all of a sudden had really quickly, actually, at that point too, a 5-stack of Class C gross. And I follow those. So I'm like, how did that happen so quickly? And that's where when I started seeing that, and then I found out that they sold Meridian completely, and all are in the cannabis industry now. So there was some influence to get them moved through fast. I'm sure it has a lot to do with the fact that Meridian's probably donated a lot of money or contributed a lot of money to certain things, but they had a huge influence on legislation, and it showed through that particular case.
If you're looking at the time period involved here, we had a Republican-led House, a Republican-led Senate, and a Republican governor, plus a Republican attorney general. So the system of checks and balances that government would normally experience really were absent during this time period. And although they may have been a little tentative in the way that they started to throw their weight around in 2012 and 2013, by the time 2015 and 2016 came around, Republicans are super confident that they could get done almost anything they wanted, and they really didn't feel like there was a consequence for some of their really bad behavior. And that's where we see a lot of these super big funds with these crazy mysterious donors building up when they didn't feel anyone else was looking over their shoulder. That's when the true self shows itself. And that Republican dominated legislature, with Rick Snyder asleep at the wheel and Bill Schuette complicit in everything that goes on, they really just cranked out the money. And then, of course, we had, the guys flying to Vegas for hookers and coke and having staffers fetch them amphetamines and things.
They're using these funds for this. The bigger issue. Yeah.
These guys make White Boy Rick and those days look tame compared to what's going on now. I mean, this is the state level
Exactly.
being controlled by outside sources that you don't know where or why they're actually there.
How embarrassing for them. They're like in the news everywhere. How embarrassing for them for
Well,
the last 2 years. Gosh, I wouldn't even want to be Shelley Edgerton right now. Ugh.
So Shelley, so go ahead, Adam. But I want to hear about what Shelley Edgerton has said in a minute.
I just love all of this because every time it's talked about, we bring up Lee Chatfield, and I love to hear that story. I want his story told over and over and over, and I don't want people to ever forget his story. So
it includes inappropriately having sexual relations with his now sister-in-law, but when she was like 16 or something like that.
Yeah, this guy. I mean,
Bible school up north. Yeah, right.
Right. This guy's story should land him in prison for so long that, whatever. I'm being kind because I don't want to say anything illegal.
What if he were a person of color?
I think that there would be a lot more prosecutorial interest in this issue. I do.
Well,
exactly.
Yeah.
In a world where
with shoes on. He just came right into politics through his family. It's just so ridiculous. It's such an entitled situation. That whole thing is crazy.
And for this particular person, for Chatfield, several of his family members were employed at one particular dispensary, which very much smacks of a payment program. I gave you this big. I'm going to do you this solid, but you got to take care of my people. I mean, does that not sound mafia-like? That's exactly what we're dealing with here.
Exactly right. It's not like they said, hey, you just spent 26 years in prison. You ain't got shit, but we're going to have you come work for us. They didn't do something like that. They weren't reaching out and helping somebody and giving someone a career. I mean, that happens in the cannabis world. Not this stuff.
Yeah. But and again, we're looking at people that we're talking about the single industry, which is the cannabis industry. But in fact, the probe the FBI has goes far beyond just the cannabis industry. And if you think about some of the real big players in Michigan politics, specifically thinking the alcohol industry, the healthcare industry, the defense industry here in Michigan, as well as the automobile industry, there's a history of secret parties where you have to bring your checkbook and you get all kinds of special favors while you're there. This is not uncommon in Michigan.
I like to tell this story how Michigan is the only one of 50 states that has a law that says you cannot sue a drug manufacturer for a reaction to medication. Now, I had a reaction to a medication, and because I live in Michigan, I could not sue the drug manufacturer. And the only reason that law exists is because Pfizer offered to move to Ann Arbor, where they no longer are at.
So Dow was Engler with Dow too as well. Amy's son is actually going through something very similar, Adam. It's insane. You would think that they would listen to people about this situation, but they don't want to lose the tax revenue from Dow and Pfizer. So
I wouldn't be surprised. I don't know what the deal is, so to speak. I guess I'm not that knowledgeable of it, but I wouldn't be surprised if this legislature might address this issue. I remember when Gretchen Whitmer was a minority leader in the Senate, and she hated this law, and she was rallying against it at that time.
Now, I know her family has ties to the healthcare industry, so it would be wrong to deny that. But I have seen from her statements like Jamie said back when she was on the floor. Go ahead, Jim or Adam.
It's just shitty law. It's mean, and it's unfair. I mean,
the negotiation that they made, that's basically it.
Had I lived somewhere else, I could have sued the drug company.
By the way, it's not just Michigan citizens. If you're treated in a Michigan hospital, if the instance that got you the problem originated in our state, even if you're from somewhere else, you still can't sue.
Correct.
That's so ridiculous.
And it's not. It simply was a quid pro quo. You need to do this, and we will come. We will stay. We will. I mean, the legislature basically admitted it at the time. I mean, Pfizer's not building this multi-million, billion, whatever it was, structure on North Campus of Ann Arbor because the state's going to turn them down. They're not like the weed business that, had dispensaries ready to go before they had licenses.
I'm curious what the if there's talks of addressing this issue in this legislature. It's something I don't really look for, so I'm not.
I think a lot of people realize that it exists.
Right, I believe.
Because we've listened to commercials for years. Like, are you a victim of mesothelioma? Like you see these commercials all the time, but they don't.
But those are different because that's an interesting subject. The reason you see those ads is because a lawsuit has already been won, and the outcome of that lawsuit is you have to take a certain portion, spend it on advertising, and allow the legal system to come and get this money. And people think that there's something going on out there, but in reality, every time you see one of those, that company's already lost the battle. Every time that you're just registering for your money if you can prove that.
Camp Lejeune lately has been the one I've been seeing now. If you drank the water at Camp Lejeune,
right? Which
as a military person, right. Yep.
Which is almost laughable because you would think that at this point they'd have known that for a while and we'd have been hearing about it. But one guy who probably won a lawsuit or a small class action suit.
I was going to say there are always class action suits, which are then open-ended. So anyone that qualifies under that class of people can then qualify to participate in the disbursement of the award.
So lawyers get millions, and those people get
right.
Yeah, the lawyers get to sign you up, and
chemical companies have immunity, and they chose to watch people suffer to get a contract. And that's basically what happened.
Right.
And I hope they do a lot of bills that pass on accountability and transparency and lifting immunity on police officers.
I'd like to see Michigan is well known as having one of the loosest legislatures where, as you mentioned, accountability and transparency simply don't exist. FOIA doesn't apply to the governor's office, which is just atrocious. There are so many ways I'd love to see this particular legislature to handle something. But when we talk about the Wentworths and the Clint Kestos and some of the lawmakers that are in trouble right now, that might be the spark that it takes to get some legislation through. When there's an active case going on that's valid media fodder that you have to read about every week, it's pretty easy to get your people to vote yes on a bill that would radically change the way that they are governed. And that's what would have to happen. The Senate and the House would have to agree to change the way that those people are governed.
But many times they pass laws that don't apply to them, but apply to them in the future. They do that with their pay.
I understand that. Yes.
I think there's like 7 bills by Democrats and 2 by Republicans right now that were already put into the House for these particular situations, but they just got passed by.
Filing a bill is great, but if it doesn't get a hearing in the House, Trish, it didn't do any good.
Making those decisions, right?
So, circling back around to the MCMA stuff, they dissolved, but the big companies that were members are still hanging around, and some of those representation is, and we mentioned Shelley Edgerton. And so now when this stuff comes to light, people have gone to Shelley Edgerton saying, hey, what's the deal with these donations? And this is somebody that used to run the department, is a very capable lawyer, went to Dykeman with cannabis issues after leaving the department, and then hooked on with Livewell.
Now.
So I mean, this is kind of a traditionally pretty professional, ethical person. Although there were some contradictions being said when they were kind of campaigning for the anti-caregiver bills last year. She oversaw the department when there was no real oversight over the caregiver cannabis coming into the inventory and stuff. And then she claimed later on in the committee hearing that it was urgent that this type of testing start happening to avoid issues. It still hasn't happened, and those issues she was discussing still haven't materialized. But somebody like her must feel compelled to have to address these ethical issues.
Well, I guess if you work for LiveWell and someone's paying your salary, you don't really have to answer for it as long as your bosses are okay with what you did in your position.
What?
Well, she did though. She did have an answer.
But
That's
But
what I
what's that?
Well,
What did she say about this?
I thought you mentioned it last night, Trish. I thought you said that she then put it off onto Linder.
Oh no, yeah. I mean, of course, put it off on Linder. She's not gonna answer shit. I'm sorry. I just do not like this woman. I feel like she's such a shade ball.
What is ethical about what she did for a job? How is that possibly ethical?
Is there a requirement for it to be ethical? I don't believe there is.
Well, I
one.
mean, we always get shot down for non-disclosure documents if you're a call center freaking person, and you got, her, who leaves Lara, and like, oh look, I'm the president of two very large cannabis companies. Weird. And then
Dad
she
was
comes
asking
after
about
us, and she throws her opinion all over the news, and now she looks like an idiot, and I'm glad.
Dabs is asking about your reference to Pharmaco. LiveWell became Pharmaco then?
Yes, there's a merger. So she is actually the president of Pharmaco. It says it on her link. It says it on her LinkedIn right now too. So
I mean, these people for years have talked about keeping legislators from becoming certain things after they left office. And here the director of a department is now able to go in and, I mean, it's disgusting.
Regulator has become employed by the regulated, and there's no way you can look at it and not think that she was influencing politics before.
I hate to say this because he was the nicest guy in the world, but at least they sent Brisbane off to, measure things and shit. I mean,
the Alaskan outpost, yeah.
Right.
Construction codes department, which I guess
whatever.
I mean, things, is it not? Yeah.
But I guarantee you he's making as much, if not more. The point is she's now in an industry that she's set up, and it flabbergasts me. I mean, it really does.
influence of colleges, influences in so many different things. It's a lot of hands in a lot of places.
So when she says she blames it on Linder, though, let's explain to some of our audience who might not be familiar with who Steve Linder is exactly why it might be completely valid that she blames a lot of the stuff that the MCMA did on Steve Linder.
Wasn't he an assistant or advisor for Gerald Ford? Not Ford. What president?
I don't know.
Oh,
I don't know what he was.
I don't know.
Oh yeah. He's been a long time politician. He knows the ins and outs behind everything.
Yeah. Dennis totally aware of him. Worked with him in the past. Our friend Dennis Shornack, who was worked with Governor Angler for many years.
Yep. And also briefly Governor Snyder too. Steve Linder actually founded the MCMA, Michigan Cannabis Manufacturers Association,
which was just the most recent incarnation of a large group doing the same.
They'll have a trade association that doesn't do any good, so they kill it. They start another one, it doesn't do any good, so they kill it. And this is just the same cycle.
Some same members, but different in some cases too.
Right.
But the difference here is that in this case, Steve Linder resigned and retired before the end of the death of the trade association. Adam, you were trying hard to get in. Go ahead.
No, he just has never won anything. None of the things he's tried in the weed game have been successful.
I don't know.
None of the major shit anyway.
Don't get me wrong. He's getting paid. He's making.
Yeah, he won. Yeah, as a lobbyist.
As a lobbyist, right? Yeah. And that's the problem, is that he's a well-known lobbyist. And it's my understanding that when the package of bills showed up in some of these Republicans' hands, many of them went, "Oh shit, it's a Linder package." Like, really? This guy again? And the problem.
very revered for many years, but just lost some
Right.
steam and credibility.
Very Rudy Giuliani, right? I mean, you think about Giuliani.
Right.
At one point, had a really good reputation within his industry and was respected by those. Could walk the halls of a house and be respected and have handshakes all the time. And then slowly devolved into this golem-like Smeagol creature that stalked the halls, leaving a slime trail behind him. People avoided; they would actually walk around different ways to get to places just so they didn't have to pass him in the hall. And you know what? That's kind of accurate, I think.
Rick was one of the lucky ones in which he purposely approached and engaged in conversation.
You know, but that was only for his own sneaky little effort too. What he really wanted was to be able to say that he'd spoken to representatives of our community,
Right.
and he didn't really have to say anything other than he had spoken to representatives of our community. And you know,
was scared. He told me,
look, fuck you, Steve, was all he really needed in order to have a conversation
but
with.
he
our
was trying to be
community.
a victim, if I remember correctly. Like, I'm scared, these people hate me, or something. I don't know. I forgot the details, but
There was a hearing in the House of Representatives where they gave a bunch of time to House reps, and then they gave a bunch of time to public relations specialists, and then they gave about 25 minutes to the Michigan Cannabis Manufacturers Association. And when they finally finished, all the other people who were getting paid to be here, they finally gave time to those of us who are actually there voluntarily. What were you saying, Jamie?
I just said clown show when you talked about their 25 minutes.
Clown show. He brought out a bottle of whiskey, he brought out a beer, he brought out a bag of what looked like supposedly cannabis in order to make this big circus demonstration. So I got up and I sort of took the chairman of the House of that committee to task, and I got about 4 or 5 minutes out of my mouth before they kicked me out of the fucking chair. But the reality is, if you look at how much time the MCMA was given, literally 25 minutes. Back the tape up. You could check it. I did because I wrote about it. 25 minutes.
With visual materials and a whole presentation and a bunch of bullshit.
They had big cutouts of cannabis plants. Their goal was to show exactly how much space 12 cannabis plants takes up in a home. And their goal was to try and let those lawmakers know that allowing the average Joe in Michigan to grow 12 plants at their house was dangerous. And they wanted to reduce the plant count that anyone could have to grow at home. So they started to bring these big 12 gigantic cutouts out, and the committee chair said, whoa, what are you doing? You can't do that. You can't block off the cameras. You can't block off all the rest of the stuff. So they clearly had set up a whole bunch of display that even at 25 minutes, they didn't get all in that they had planned on talking about. And it's a 1 hour program. It's a 1 hour committee meeting. So we really got rooked on that one. And I felt sorry for Sunshine Daisy and poor baby Anna who were there. And, you know, Susan Fisher delivered some super powerful testimony talking about how angry she was that they weren't.
You did a great job, Sue. Did a great job. We had a few high points in there, but it just
we did. But the fact is, they gave such deference to the trade association was my real point.
It was so telling, though. It was so telling. They showed their hand. It was amazing.
You know what? They didn't win. They ultimately it didn't happen, and that was and
right.
That's that story. There was a bill 5512 that went through. I won't get into it too deeply because we're kind of getting to the end. But I think Pam might find it to be a little bit interesting. It was a lot of the judges wanted, and it surrounded specialty courts and how cannabis would be used in like a drug court, for example. And go ahead, Adam.
Do we know the judges wanted it?
Yes, there's no question about it.
They don't care about people. They wanted their paychecks.
They're the ones who got lobbied.
Well, hold on. Or was it explained to the judges what it meant?
No, I was
okay.
By Representative Callie's secretary or whatever her advisor was. I think that at first, I don't know if they knew who they were speaking to when we came in to speak to her about it, but he just said, you know, it's not a big deal. They just want to make sure that they get their funding. So
some judges had good intent and didn't realize that it was some wacky thing, really, because it was beyond their scope to understand a law like this. And that part is true, I would say, and they very confidently saying, "Oh yeah, this is a really good idea. This is a way we can help. But this is the way we can bring in cannabis use possibly for those who might need it in these courts." reality is they just needed to respect the existing law. And that was the message that we had a really hard time getting across. And that when you have a bunch of judges and GCSI, which is, a very powerful lobbying organization, saying stuff like, we're going to lose federal funding, they can't come in anyway right now. So if we did this, at least they'd have a chance to come in. So ultimately, Pam, what happens is the immunity that medical cannabis users are supposed to have via the Michigan Medical Marijuana Act, totally ignored, taken away. Although not that it hasn't been traditionally ignored, since the passage of the law anyway, but specifically lifted. The ability to use cannabis while in the program as their medicine, not necessarily taken away, but requires a special hearing in which they bring the doctor in to be a witness, to testify whether or not it's needed. And then the judge, though, then makes a final. So if the doctor can even come in, then you have that hearing. But that's not even that common, that the doctor will cooperate and different things like that. And then the judge ultimately will make the medical decision as to whether or not the person should be using their medicine. So
we have judges practicing medicine again, like they do with Suboxone and methadone.
Right.
Yeah.
Yes,
Exactly.
100%.
So I thought you might find that one interesting and understand, those what we were dealing with that. That was a tough challenge. The huge things throughout the year, though, we did do a good job of, getting some information, the right place, right time. MICAA, big industry association, generally on our side for most of these issues, helped out quite a bit. Had they wanted some of this stuff to go through, but it would have been probably impossible. So they philosophically, we come to some differences because they're primarily a business association. So some of the other issues that we can get into, they aren't
consumer-based issues, right?
Right.
But I think consumer issues and business issues are more in alignment more frequently than people give us credit for. I think what's good for us as consumers oftentimes is good for business, although it may be bad for a particular business model. I think satisfying their customer base is ideally how you generate a healthy industry. If your customer base demands both.
Josh sets the tone for Meds Cafe as the CEO, and in decision-making process, he reminds people quite often, think in terms of what's best for the consumer. Yeah. And use that as the basis when you're trying to figure these things out.
And sometimes that's easy. What's best for the consumer? Sometimes more information. Sometimes what's best for the consumer, a more streamlined process. So it depends on how you're looking at it and what the particular issue is. But having a consumer-based focus as opposed to a fiscal-based focus, it shows. When you go into places and you can tell that there's a genuine concern and love for the people that they see every day, it's way different than a place that's just about turning and burning their personnel, and they don't make any personal connections because they underpay everyone and overwork them, and then give them a lot of hassle when they complain about it. So,
before we go to, I'll recount an experience the other day with Justice Bernstein, who reached out to the Cannabis Caucus and said he wanted to discuss a few issues with people. And I was there. Leah Schuyler was there, the chair of Cannabis Caucus, and Amy Carter was there with Trish. There wasn't much discussion about cannabis, but when we were able to meet with him, he used the platform to profusely apologize for his position on the staffer that was being hired into Justice Bolden's office. And that story is about the staffer had a felonious history, and part of the story was that he fired on the police. He thought that was over the edge at first and was very public about it and did not want that and tried to stop that. And he got criticized for it. I thought Leah did a really good job of explaining how the criminal justice system reform component of our movement, kind of likes to see people, pay their debt to society and be able to rejoin things and have a good job like that. And, and that was kind of cool, and that kind of stuff. And, but he profusely, and Trish was there, profusely apologized for that position, said he was wrong, had no defense. I said, we were kind of like responding in order. And I said, I didn't expect to, discuss this issue, but I'm happy that you've changed your position on it. And he said, I didn't only change my position, I gained a passion to help with these things and stuff. So we'll see what happens.
That's really helpful. Good to know, Jamie, because we're still doing the demonstration work with people trying to get away from harder substances and helping with marijuana products. And one of the researchers submitted that paper to be published in one of the international journals, and it was not accepted. We don't know why it wasn't accepted. We are hoping to submit to another journal and have it accepted. And I think in the meantime, he's trying to look at what possibly could have been the issue. But I think sometimes it's, how well known that researcher is in these publishing circles. And if they're a newbie in the political circles of these publishing circles, that can heavily impact whether they get their piece in or not. But I was poking around looking for other pieces, and I found a really great piece about the Brazilians have always been pretty far ahead of the game in terms of harm reduction work with crack users, because there's a lot of crack cocaine use in Brazil. And, Detroit for a very long time was you couldn't get powder cocaine in Detroit. Detroit was a crack town. And, and so Detroit still, that's, where we have the most people using crack in our client base is in Southeast Michigan. But anyway, so I've always looked to Brazil for interesting programming, but they had a great article about using marijuana to help people get away from crack cocaine.
Very cool. Yep. And that's cool. Part of this kind of, definitely related to the study.
Kind of away from addiction, right? Yeah. Many people have cited that about cannabis.
Yeah. We put some of those articles and stuff that point to that conclusion with some of the discussion on 5512 too, trying to let the judges know you shouldn't be looking at it like it's still on the list with these other things. It's actually something that could be helpful in people who develop dependencies for these things that should be of more concern. Is there anything else you want to add before we wrap up, Pam? I really appreciate you joining us today. Really interesting as usual. Thank you very much.
No, I always enjoy participating, and I always learn, and I appreciate you guys very much. So like I said, I'm always like, wish I weren't so busy that Tuesdays at 4 isn't always a good time for me, because I'm like, why do I ever miss this? Because I learned so much here. So thank you so much for inviting us. And again, I really love my time here. So thank you.
Excellent.
Yeah, very nice. Thank you. Hey, Tricia, anything you want to make sure you get in? And also thank you very much too. I appreciate having this discussion with us. And of course, you're welcome to come on anytime.
Yeah. I have teenagers, so I guess I'm just going to use this opportunity just to have people, give out all their positive vibes and prayers or whatever they do for the people in Turkey and Syria. Those numbers are growing. That energy needs to be pushed out. I feel like that. So that's about it for me.
I mean, unfathomably tragic. I would say 30-some thousand people, something like that. Just
growing.
Can't even imagine it. Yeah, I mean,
at a brutal cold time when there's no support and difficult to get supplies in, and people are sleeping on the bare ground. They said that the human toll afterwards might equal the toll of the earthquakes themselves.
Yeah, and that already decimated area sucks.
Aftershock 5.0 is horrible. I can't even imagine an aftershock.
And not to totally compound, but we didn't mention the MSU incident last night. Of course, there's need for some thought in that direction too for those families and all that kind of stuff. Adam, you want to throw something in before we?
I want to throw in too that we also, think about the perpetrator of last night's events. For somebody to get to a point that's what they've decided to do at 43 years old, it's tragic, for the perpetrator as well as the people who, are on the victim side. But, it's when you stop and you think about a guy and where he was, like what was going through his head, but to be at that point of hopelessness where that seems like an option, or what that you're motivated to make that move has just got to be a really hopeless place. So want to think about his family as well.
Right. And we don't know everything that led up to that point. Maybe there's some fixes along the line there too that we could potentially look at.
No, it sounds like another case of a person who really didn't get the support they needed. Sounds like when his mother died his dad saying he went evil crazy when his mother died. Well,
I'm guessing that he didn't connect to any support system that could help work him through that, or talk about it, or he probably had no outlet to talk about all of what went on with him when he lost his mom, but again, another person who didn't get what they needed from the system as it exists. So.
Right. That's point well taken. Think about all those perspectives.
Mm-hmm.
Adam, is there anything you want to toss in before we wrap it up?
No, I'm just happy to see that we're finally exposing some of the corrupt stuff in our industry, because we knew it existed in the game. Trust me, we know it exists in the game.
Mm-hmm.
But the industry is supposed to clean all that up, right? Isn't that why these people paid all the government all that money, so them bureaucrats could buy all that furniture and set up that big office and take
those trips? Yeah.
Take those trips. I mean, and don't get me wrong, I don't mind sending the guy to the meeting so he can meet the other goofballs like him, run, groups in the states that control everything. No problem. But come on, you're a bureaucrat. We're gonna watch everything we do. You're gonna get caught. You always get caught. And they got caught. They got caught big time on this one, if you ask me.
It's amazing. But anyways, well, thanks again, everybody, and nice show. 2 hours in. Rick, if you don't mind wrapping us up, we'll do it again next week.
One thing that we didn't talk about today was the situation with Raw Papers. The parent company of Raw Papers just was handed a bad decision in a lawsuit, stating that they can no longer claim that they're made in France. They can no longer claim they're made organically or that they source from this place. And their owner cannot claim that he invented the tube style rolling paper. Raw got busted saying a lot of horrible things. And when the cannabis community evolves through legislation and through public action into the cannabis industry, everybody expected the criminality to be at the user level. We're gonna divert cannabis from place to place. What we've really seen is the biggest criminality rests at the top. Rests at the people with the biggest power have the chance to be the biggest crooks, and some of them really are. We're seeing people getting suspended for bad practices in their cannabis industry facility. People who don't pay their bills because they made bad business decisions and now are trying to run away from it. The real harsh truth here is that tough times make tough people, and it shows you who people really are. And a lot of the people running companies in the cannabis industry right now are not people of quality. And eventually they're going to lose out. And the people of quality are the ones who made it from the caregiver market to get inside, to work hard, and don't take graft, and they don't take crap because they know that's not a fast track to success. That's just a fast track to jail. So I'm curious to see in 2023 how many more of these people we're going to see with charges against them or who lose their property because they didn't pay their bills. The criminality is at the top, not the bottom, when it comes to the cannabis industry. And the news cycle this week has just really emphasized that more than any other time I can think of. And that's it. Thank you, Jamie.
Excellent. Appreciate it. See you guys next week. Jazz Cabbage Cafe. Thanks everybody for joining us.
Thanks, everybody.
See you guys.
Hey.
Bye.
See ya.